conversation. It's being recorded, so it will be available within 24 hours on the Rethinking Schools website. So that's number one. Also, it's being simultaneously broadcast in Spanish. And so for those of you that are Spanish speakers, I'm going to go ahead and have Luz Lopez right now translate for us the information that our community needs. Thank you, Luz.
Esta conversación comunitaria está siendo grabada y estará disponible en el sitio web de MCOE en 24 horas. También se estará emitiendo simultáneamente en español. Por favor, haga clic en el botón de interpretación de idioma que aparece, aunque se parece a un globo, si desea escuchar esto en español. Gracias a Araceli Núñez, quien es nuestra intérprete el día de hoy. Gracias.
Great, thank you. Thank you so much, Luz.
You're welcome.
Finally, we want to say thank you to all of you that took the time to submit questions. We'll try to get to as many of those as you can, and we've tried to group them. So if you don't hear your question exactly, we've tried to put them together sort of in a list of similar questions, but you are also able to put questions into the chat. So I want to just take a moment to give a little bit of background for those of you that are on this call. It has been 38 weeks since the shelter-in-place order was set on March 16th, and our students started virtual learning. It's been just over 60 days, 64 days since September 8th, which is when in-person instruction began. And as of today, we've had over 400,000 student days where staff and students have been back in person. We are very proud of where we are here in Marin County. And I want to acknowledge that this has not been easy. It has been challenging. We have been leading the way throughout not just our Bay Area, but also in our state. And I want to pay tribute to Dr. Willis and Dr. Santora for all that they have done. There is no question in my mind that the leaders in the state of California related to this pandemic and prioritizing our children, our families, and our essential workers goes to Dr. Santora and Dr. Willis. They have been willing to be available to us morning, noon, and night to answer questions, to think about issues that were challenging for all of us. But most importantly, they have been guided by science. The public health aspect of this has been first and foremost our priority and what has led us to where we are today. So today we're going to hear an update from Dr. Santora and from Dr. Willis when he's able to join. And so Lisa, at this point, I'll pass the screen and the mic to you.
Thank you very much. And thank you everyone for joining us today. I apologize in advance if there's some background noise because I'm at home with my kids. It's their hybrid flex schedule. So we have a full house here and are learning how to adapt to that. And I think that's been the key for us together as a community is adapting. This is a historic challenge that we are battling day to day together. And we have seen that when Marin County residents work together, we can flatten the curve and be effective. And what you're going to hear today, I think, are both demonstrations of our success and opportunities to continue our learning and continuing to be focused on what I believe are our most important members of our community is our future generations. The children who have, I believe, are now becoming the next greatest generation, developing the resilience that they need to thrive as they grow into an adulthood. And I am thankful for everyone on this phone call for your contributions and commitment to our children. And that has been our focus since the beginning, as well as a focus on ensuring the safety for the entire school community, children, parents, school staff, and teachers. And again, it's working together that I think has allowed us to have early success with the return to school. And so I just want to provide a quick update. Dr. Willis apologizes. His schedule today was to be here with us at the beginning of this presentation, but he is presenting to the Board of Supervisors. I think right as I am speaking, that normally starts at 9 in the morning, but it got shifted a little bit because they're talking about climate change today at the board. And again, it makes me think again of our students and the critical importance of getting them back into classroom instruction is because they are our future leaders, and they will be the key problem solvers as we move to address issues like climate change. So Dr. Willis will be joining us in a little bit. This is just our epi curve. We're making public health professionals of all of you. And this is where we saw in July that large outbreak, or the first wave in Marin County. We believe that this actually might have been the first 2 waves. You hear about the 3rd wave. And I think what we experienced in the Bay Area and in Marin County is that we successfully flattened the curve, which resulted in that big surge after in spring and after, I guess, early summertime, when there were graduations and early weddings and people were cooped up, and we started having gatherings that resulted in a surge. We also saw the economic disparities in our community and income inequality that was driving COVID-19 transmission in the canal area of San Rafael among essential workers who, due to low wages, often are forced to live in crowded housing conditions. That story has changed with this 2nd or 3rd wave of COVID-19 in our community. Today, we're, I believe it might be one of our highest days, if not our highest, our 2nd highest number of cases per day. We had 89 cases per day today. So we're on par with the rest of the Bay Area and seeing increases. One of the concerns for us in Marin County around the critical importance of controlling COVID-19 transmission is protecting our healthcare system. We're a medium-sized county with 3 receiving hospitals, and there's not tremendous capacity like there may be in other larger counties. What we see was when there's more active cases, there's higher hospitalizations of COVID-19 residents in our community. Around 5% of individuals who test positive for COVID-19 will be hospitalized for COVID-19 complications. And so we are endeavoring to protect our healthcare system and access to hospitals for, it's not just COVID, people are experiencing the rest of life where heart attacks and strokes. So we need to ensure that Marin County residents have access to our critical health infrastructures. Now on to the good news, and this is our success. We have been working since, Mary Dan will say, since Saturday, March 14th, to plan for a safer reopening of schools. And we have demonstrated our success. We now have over 415,000 student days. That's the number of students times the number of days they've been in school. And this slide is old. There are now 2 suspected in-school transmission of COVID-19 from staff to staff. We've had no student to staff transmission or no staff to student transmission. And I think this is, again, showing the success of a thoughtful, data-driven, science-based approach towards reopening schools in our community. And again, I'm thankful to everyone on this call who's participated and endeavored with us and supported this effort, and for staying vigilant, because that's what we've seen in our community is when we're not vigilant with our behaviors, and we become lax is when we expose ourselves and our families to COVID-19. And I truly appreciate the commitment every day of school staff, of parents, of students, staying committed to staying vigilant so we can keep schools open and have more schools open. So this is available on our website every day. It's updated on Friday. This shows the number of schools that are currently open for in-person instruction. It shows the number of cases that our team has investigated on that right-hand side. So we've investigated 30 students and 7 staff who have tested positive and have been infectious while on a school campus. And again, so this, what happens is we are notified in public health. Our nurses work together closely with schools and the public health liaisons to identify when was their last day in school and to determine if we need to close cohorts. And so we have very conservative measures, again, to keep our record as strong as possible. This is not a zero risk environment. There will be school-based transmission, but I think we have successfully demonstrated that we can truly minimize that risk in the school environment. So this is one of the things we were closely following. The data we were closely following is right after we reopened schools. And this is, again, to determine, are schools a driver of community transmission? And what you can see here is after schools reopened, we saw the case rate in Marin County begin to decrease. And it's not that just schools open, there's other factors that were contributing to the case rate decreasing after the reopening of schools. But it also shows one of the things that would have been concerning for us in public health is if when schools reopened, we started seeing increases of COVID-19 cases across our community. So this is further evidence that shows that schools are not a driver of community transmission of COVID-19. And then what we also calculated is the daily risk. So what's your daily risk in school? We share the information. There's been 2 cases of suspected school-based transmission over 400,000 student days. And then we looked at what's the risk of being in the community. And so these are community dwelling individuals. So it takes community days, or I guess that's probably the best definition, is the number of residents who are living in the community. So this excludes our long-term care facilities, nursing home residents who have tested positive, and excludes that number. So where are people getting sick? And what you can see is that the risk of contracting COVID-19 is significantly greater, 15 times greater within the community and not in the school environment. And so this is just showing overall where we are now. We are expecting that today will be projected to be in the tier purple. And at the same time that Dr. Willis, probably right as I'm speaking right now, is announcing to the board this stay-at-home order for Marin County. And so what we saw is we did a great job through the month of October, but since Halloween, and then moving into traditional holiday gathering seasons, we've seen a significant increase of COVID-19 driven predominantly by private gatherings and mixing of households. So it's been a hard haul. I think people have fatigued with COVID-19 and had a heightened sense of safety and protection against COVID-19 greater than what they should have, and started mixing their households, traveling, and having more traditional holiday behaviors, which we cautioned against. And so this is where we are today, shifting upwards in our number of cases. What I described is that there's been a very different change in the dynamic of COVID-19 transmission. In the beginning, we saw, again, essential workers, many of whom were in our Latinx community, had the majority of COVID-19 cases. There was a point where I think 75%, approaching 80% of COVID-19 cases were among the Latinx community. Since this, I'll call it the fall surge, we've seen that change dramatically. Again, it's really the majority of COVID-19 cases are among white residents in our community. We've seen a shift of COVID positive cases to the 50 to 64 age group. And again, predominantly driven when we interview cases, it's by private gatherings. That's the primary mode of transmission in our community. So with that, we are implementing today, effective at noon, a regional stay-at-home order. The Marin County is joining other Bay Area counties in accelerating the implementation of this order. We are on schedule for the state to mandate this order and to issue this order for Marin County. Right now, the state is expecting it December 14th. Bay Area counties, health officers came together and identified that there is no benefit of delaying the implementation of a stay-at-home order, especially around the private gatherings that we know are driving our infection rates and hospitalizations up. We're also seeing with that also comes increase in deaths among Marin County residents. So Marin County is launching with other Bay Area counties. I believe Santa Clara went first on Saturday to issue a stay-at-home order for all Marin County residents effective today at noon. So all gatherings with members of other households, indoors or outdoors, are temporarily prohibited, and that's through January 4th. Everyone should stay at home at their place of residence unless for allowable and essential activities, which most notably for this presentation includes schools. Schools that have been reopened for in-person instruction can stay open, and schools that have already been open and have planned to reopen can continue to reopen. And then there's other allowable activities, worship and political expression, And there's also retailers are allowed to operate indoors, but with limited capacity. The other major changes that you'll see is the closure of outdoor restaurants, as well as nail salons and hair salons. And this is a very challenging thing we appreciate for the community, especially our small business community. But this is our last major opportunity as a community, again, to work together to flatten the curve that we're experiencing, to protect our healthcare system, and to behave more like we did in March and April, and really only engaging in those essential behaviors and not looking for the gray spaces and to rationalize why we don't need to stay at home. It really, this is the time we need to protect each other, stay at home, just change our travel plans if we had travel plans, and hunker down for this winter. And this is an unknown time for us. Never in my life has there been a pandemic and a flu season. We already are seeing our ICU capacity diminish. And this is over the next 4 weeks. We believe that if our residents work together, that we can flatten the curve again and protect our healthcare system. And this is, I just want to close up before we get into the question and answer, and this might address some of the questions that are already coming up, is why can schools stay open? And I think what our grounding principle is always, again, being data-driven and looking at the evidence. We are demonstrating that schools are a safer place to be and that they're also essential. Being children-focused, we are seeing that children thrive when they return to the in-classroom environment. That is where educators practice best, and that's where children learn best. And we have proven that we can create safer environments for this to happen. We've been committed from the beginning to being transparent and having this public process and having meetings like today to share our data and to share information and to engage with the entire school community, from parents to staff, and to ensure that we're creating the safest possible environment. We have a 30-point guidance document that's been adapted, and we have some adaptations today that I'll introduce. We are testing school staff. We have a family handbook that gets updated every time we update into new tiers, and we'll be releasing an updated version of our family handbook today, so parents understand their roles and responsibilities in protecting the school environment. We're working hard to increase access to testing until the vaccine comes live to the general population. One of our key tools for protecting our school environment is ensuring that everyone has access to testing, whether they're symptomatic or they are getting tested because they have had a known exposure to COVID-19. It's our commitment as a county to ensure access to testing. And then we have decision trees, again, that can help our school nurses. Part of the team on my side that you often will see Mary Jane and I, but there's an amazing team of nurses across Marin schools and public health, our public health team and our Office of Education team that are working diligently to support the implementation of all of this guidance at the school level and at the family level. We also have a different approach. We have a universal precautions approach. We developed our plans and guidance, assuming everyone that is walking into the campus could be walking in with COVID-19. And again, that's why we led as a county, led as a community in implementing the best practices that we are aware of in order to decrease the risk of COVID-19 transmission, assuming that everyone could be walking in with COVID-19. And that begins with, again, screening at home. So, well, first begins with parents assuming responsibility and reducing their engagement in risk behaviors, so gatherings. Second is screening their kids and making sure they're not sending sick kids to school, and then quarantining if they did engage in a high risk behavior and getting tested as appropriate. And then it's, again, the instructions that we've provided to students and families around hand hygiene and face covering and respiratory etiquette. No one really should be coughing in the classroom anymore because they shouldn't be there. But again, working to have all those protective measures to prevent, if COVID-19 was on campus, to prevent any spread. And then again, I can't thank our schools enough. They've worked tirelessly to develop a school site specific protection plan that have been reviewed by our public health nurses to ensure that that schools have the best plans in place to safely support the return of students. So do you want to jump in here with me, Mary Jane, on number 8, and then we'll go through this one together?
Sure. So everyone's familiar with the 30-point guidelines. And this will be the third time that things are modified. Number 8, and maybe Lisa, with this, we could talk a little bit about testing and what we're doing in the community right now. But the testing guidance is now recommending that our educators receive testing rather than every 2 months, every month. And so we have been working hard throughout the community to get as many options as possible related to testing available, whether through our local health providers or through a variety of different testers. Many of us, for example, are using Curative, which is a self-administered but proctored test. And that now is going to be open in our community 5 days a week to all members of the community. We've been making sure that when opportunities come up, we're raising our hand as a community. And so soon we'll be piloting some antigen testing within our school system as well. Lisa, there's several questions about testing. Would you mind addressing anything else we can about that at this point?
So until the vaccines become available, and it's been this way since March, one of our key responsibilities in public health is ensuring access to testing. So we've been working to optimize our testing environment. One is that our LHI test site just doubled its capacity. That's the site at West America Bank. It used to offer, I think, 180 tests a day. Now it's up to 300. It was 132 tests a day. We always exceeded our testing. Now it's up to 300 tests a day at that site. We're working with Curative to have mobile testing across the 5 geographies of Marin County on a daily basis, and they have high volume capacity. We're also working with Curative to bring back the drive-through testing, as well as an additional kiosk, which will offer 5 days a week testing at 2 different locations in Marin County, and we hope that to go live by early January 2021. We also are working with providers in distributing Binax Now antigen tests. This is for symptomatic individuals. So your pediatricians, family docs, if your child has symptoms consistent with COVID-19, doctors will be able to use the rapid antigen test in order to have a rapid result for students, and again, to support not keeping kids out of school unnecessarily. Still, even though we talk about COVID all the time, if you have any of the symptoms of COVID-19 and get tested, most likely you're not going to test positive for COVID-19. It's probably another virus or another bacteria that's causing those symptoms, unless you engage in a high-risk activity or had a known exposure to COVID-19. So that's, again, even though we talk about COVID all the time, it's really not the most people who have symptoms of COVID are not going to test positive for COVID-19. Our positivity rate is still in the 3% positive, and probably of symptomatic individuals, probably around 10% are testing positive for COVID-19 if they're symptomatic. It goes a little bit higher, like I said, if there's a known exposure. So we remain fully committed to getting the newest technologies and testing into Marin County, partnering with the state on a pilot for antigen testing at the schools. And again, that's all to make sure we create that safest possible environment that we can based on available science and data.
Okay, so next there's a revision in number 19, and this is essentially the reminder for all of us how important it is that we are using as much outdoor air as possible. And the addition here is having our school districts take a look at, they're looking at their air quality, and I know people are doing that, and several schools have looked at the possibility of portable air cleaners. And so I think everyone's aware of that. We've had those in play. And so this is expanding a bit on the issue of the air quality in our school settings. Lisa, anything to add there?
No, just the critical importance of windows. COVID does not like fresh air, and windows are probably the most cost-effective solution for creating safer classroom environments. So, and we know it might be a little bit cold as we're moving indoors. We thought it was very important to strengthen this language around the importance of effective ventilation and filtration moving into the winter season. But don't forget the basics, and opening up that window and allowing fresh air to circulate is just one of our best tools. Nature is one of our best tools for protecting us against COVID-19 transmission if there happened to be someone infected with COVID-19 in the classroom.
Okay. And then the shift in number 24 deals with face coverings. And actually, this was our initial language, but bottom line is everybody now, we're supposed to be wearing face coverings essentially all the time, including young children at any age above 2. And so we're definitely trying to make sure that students are able to be provided information about why it's important, but also that they're able to practice wearing their face coverings. The success rate that we're seeing is actually very, very positive in terms of the face coverings. There were a lot of people that were concerned that that would not happen. The issue then is when you go outside, are you able to take a face covering break? And this is trying to allow for the opportunity to actually have a student have a space that they could go to take a break. And obviously when they're eating lunch, there'll be distance appropriately, and they would not have their face covering on. Lisa, anything to add to that?
Just to include that, that's going to be more of a universal language as we're moving in these next 4 weeks with the stay at home is the expectation with indoor and outdoors. People will be wearing their masks, but we fully support face covering breaks, especially for all kids, for adults. We all need a break from the face cover. Outdoors is the best place to do it, and keeping people 6 feet apart is the safest way to do that. So we fully support face covering breaks and getting outside, again, putting that jacket on, getting outside, getting some fresh air. And then I think that will help support kids, especially who have a hard time wearing a face covering all day, support them maintaining that protective practice.
Great, great. All right, so bottom line is for those of you that are the liaisons, right, public health liaisons, and you have meetings every Thursday, at your meeting this Thursday, so just a couple of days from now, the information will be provided in the form of the 30-point plan, and we'll try to get that out to you actually prior to that meeting. Dr. Willis has arrived, just for everyone to know. Oh, Lisa, do you want to go through this slide? Sorry, before we.
No, we can just have it up there while Dr. Willis introduces himself. And
yeah. Hi, Dr. Willis, how are you doing?
Hi everyone. Sorry I'm late. Was speaking with the board about the news about the stay-at-home order, and just wanted to thank MCOE, Mary Jane Burke, the team there, and Dr. Santora for, I think, being champions of what has been one of the most successful efforts across the state to safely reopen schools. I think our data supports that this has been a large and successful endeavor among all the different complexity of our COVID-19 response. This has been an area that we've really prioritized, and it's paid off. And I think it's offered lessons not only for Marin, but for the state and the nation even. CDC yesterday, or just a couple of days ago, came out with a very strong statement that schools should be open as a matter of public health. I think the way they framed it is that schools should be the last to close and the first to open. When you're talking about these policies in terms of stay at home, and that's been fresh in my mind now as we've just made some decisions to close more sectors as we're seeing surges in cases. And validates our decision to, again, prioritize keeping schools open as much as we can. So, and that's thanks to the excellent work. It's all about the how. It's all about the how. And that's something that's just, there's been a lot of excellence from the teams here. So thank you for that. And I'll step back and allow Dr. Santora to continue where we are in the presentation.
Okay, so I'm going to start with some questions that we received previously, and then we Ken Lippy, I'm going to ask you to start looking at the questions that are coming into the chat. So there's a few questions here and that are from teachers, and here's one. We're in the purple. I can't get my nails done in a salon with just me and a salon worker present for 30 minutes, but you're saying I can spend 6 hours with 90 students. That's one. And then the second one on that is, why are teachers listed as essential workers?
you want me to do that one, Matt? Oh, you're muted. All right. So I think it goes, it really starts with the word essential. As we're moving into the stay-at-home order, we're trying to minimize non-essential activities. Again, helping residents see that it is time to hunker down. It is time to avoid the slippery slopes and paths towards socialization and gatherings. And so what we're doing now as we implement the stay-at-home order in a few minutes from now is we're using the same guidance from the state. Since we began in March leading before the state as a Bay Area, and now as the state has fortified its public health response, we're always seeking every opportunity to align with the state. So as we move into the stay-at-home order, we're following state guidance, and it really is around what is essential. And so, and I'm a big proponent of getting my hair done and getting my nails done too, but those are not essential activities. And that is why we need to focus now. It's 4 weeks to work together, focus on what is essential, and having children in school is essential. They thrive in school, they learn best in classroom, and we again have demonstrated that schools are a safer environment than honestly many people's own homes because of the decisions at homes that are slippery of adding more households and more gatherings and moving from outdoors to indoors. That's where we're seeing community transmission.
Okay. So there's
And
many.
can I follow up? Can I follow up on that?
Please.
Because I think it is consistent. If we are, and we do call our teachers a part of our essential workforce and schools an essential social function, that does factor into the vaccine distribution plan. The way we're approaching the vaccine distribution plan is, it's like a pyramid. At the very top, and that's starting even next week, which is, I think, one of the bright spots in an otherwise dark, winter right now in terms of just our COVID-19 experience in terms of surges in cases. But we are seeing vaccine arrive probably next week would be the first, starting with our skilled nursing facility staff. Some of the essential, then from there, we'll be moving into hospital staff, residential care facility for the elderly staff, where they're really most vulnerable and taking care of people who are most vulnerable. Then first responders, and then we get into other critical infrastructure. And that's where teachers are part of a cohort that is not the general population and is not put into the general population in terms of when the vaccine would be available, but are part of a privileged and essential function that would be prioritized in terms of the timing. And we don't know when that is yet in terms of for our school staff, are part of this. It's, February, late January, February, somewhere in there.
So there's a series of questions about sports. So if I can just read several of them and then have someone try to answer them. What are the specific guidelines, recommendations, or mandates regarding athletics at school, recompetition, athletic activities at school, such as conditioning, swimming, running, after-school activities, such as walking group photography, youth sports, traveling teams? Can we continue to play golf?
So we have updated our youth sports guidance in consistent with the state, as well as the new stay-at-home order, which shifts all youth sports to outdoors. So youth sports activities can continue. They need to be outdoors and following the cohort guidance, which is no more, I believe, 14 participants and allowing 2 coaches in that cohort. And again, part of the cases that we've been investigated really have been driven around youth sports, where there's that, again, a slippery slope of people's protective behaviors where sports have been, are involved, and both more carpooling than necessary, engaging in competitive sports, which is not allowed in the state of California. At this time, our youth sports, again, if they are operating with the cohort guidance outdoors, it should be for strength and conditioning only. And so we appreciate that puts a burden. We know there's many scholar athletes that are there out there, but again, these 4 weeks are really critical for us to avoid the unnecessary clusters and outbreaks that, although we see in the younger populations, don't result in hospitalizations or severe disease. What we're seeing is when when youth go back into homes and are infected, there's that risk that older adults can, who are more vulnerable, can develop COVID-19. It really is in the household where COVID-19 transmits. And so this is an important strategy at this time in the pandemic, to be as conservative as possible, knowing how critical sports are in our community.
So this is a simple question. Oh, Matt, did you want to say something else?
Yeah, I just want to add as a general principle, right now we're in this interesting phase where the state is defining the elements of the stay-at-home order. And those are shifting and being clarified, and then we have our own local. So there may be some reconciliation there as the state further clarifies what they mean by the stay-at-home order. And we just want to make sure that there's an asterisk around all of this, which is that it may change depending on what the state determines is necessary.
So this is sort of a fundamental question that underlies a lot of the questions we've received. If the virus is worse than ever in our community, why are you allowing schools to continue to stay open and allowing cohort sizes to increase?
I think this goes back to our data, and the evidence that we have seen is that our community is not getting infected on the school campus. Where we're seeing the disease transmit in our community is in private gatherings at private households, where it's exceeding, where people are not following 6 feet separation and they're not wearing face coverings, where they're breaking those protective practices. We have demonstrated with the implementation of the school site specific protection plans, with working hard with parents and engaging them and decreasing their engagement in risk activities, screening their kids coming in and wearing face coverings throughout the day, maximizing physical distancing, that we can create an environment, and also being responsive when we do identify a positive case. We do close cohorts at this time. So really taking a very conservative approach to protecting this most precious community for us, which is our schools. So it is a safer, what happens if schools are out of session, then parents and guardians are struggling to identify alternate childcare arrangements, identifying socialization arrangements to minimize the isolation that their children are experiencing. And schools are such a critical part of our infrastructure. It provides that supportive, stable, supervised experience. We're not seeing transmission. Dr. Willis and I always say we follow the data. If we were to see any surge in clusters or cases, we would reevaluate our position. But at this point, one of the safest places for people to be is on a school campus following the school site specific protection plan.
Ken, can you call on a few questions that have come in through the chat?
Yes, here's a few questions that relate to school opening. If schools are not super spreader sites, then why can't schools that haven't opened yet open in this new order?
That is guidance right now from the state. Marin County has been leading in the state, and we've been sharing our data of the Marin County experience with the state and hope to share it much more broadly because we are demonstrating success. At this point though, and this is where Matt was describing the asterisk, the state is evolving in its response and trying to implement as quickly as possible the most up-to-date, data-driven, evidence-guided policies and decisions. And so at this point, what is in play by state order is one, we're effectively in the purple tier. So today it's announced that we're in tier 1 or purple, and under current state guidance, only elementary schools that have a waiver can open. And then secondary schools that have not yet opened cannot apply for a waiver. And so that is where Marin County is now striving to align with the state. And that is the current guidance from the state, which we know in COVID land is always going to be evolving, because our goal is to return to normal, whatever normal is, as safely as possible. And as the state learns from local jurisdictions like Marin County, we anticipate there to be updates in their own guidance and policies as we move forward.
Yeah, can I also just elaborate a little on seeing some of the questions in the chat regarding community transmission? I don't, Lisa, did you go over the rates, our community-wide COVID-19 rates kind of over time since September 8th?
I have yes, I can bring it.
You went over that. Yeah, I mean, so maybe that's exactly. So, I mean, this is, I think, an important point for us, which is that our schools began to reopen really in earnest while we were in the purple tier on September 8th. And we had, I think, within 2 weeks, I think 30 schools open, and they continue to open. And if you look at our community transmission rates since that interval, it just could progressively continues to decrease all the way into November. And the trend with regards to school reopening is each week over that interval of progressive declines in transmission rates in the community was accompanied by increases in numbers of children coming into schools. So we had an interval where Marin County, up until I think today was when we were announced to be in the purple tier, we were essentially the last non-small rural county that was not in purple. So we were the last one standing in terms of having pre-surge rates. And we are also at the same time the county that had among the largest number of our children back in classrooms. And just from a broad environmental or ecological standpoint, that means something. And it means that we are and only 2 cases of school-based transmission. So I just wanted to sort of offer that opportunity to step back and think about this epidemiologically for the population as a whole. Thanks.
Ken, do you want to continue? Maybe he's not here. Okay, let me go.
I'm sorry. Yeah, if or when Marin County schools do go into purple, schools remain open, correct?
Yes.
Okay.
Schools that are open can remain open, and schools that are open can continue to return more students back into school. And that's because they've demonstrated their readiness and ability and their competency at reopening their school under their school site specific protection plan. And again, I would anticipate that there may be changes around school reopening in the purple as the state gets to see more data that schools can open safely. Like we said, schools can open safely in a purple zone if they're implementing their school site specific protection plan. But again, that's where we are now, is that we are in purple. And so we're following the state guidance in the tier 1 purple.
And could I add to that, which is a lot of questions that follow that are so what would be the criteria for closing schools? And the criteria for closing schools really relates to the individual school setting. As we've seen with safely reopening, it is all about the how, and the school specific experience is the most important determinant of the safety. And that's similar for how we would choose to close schools. Obviously, it's any school has the authority to close or open. From a public health standpoint, our decision to close a school would be based on some pre-identified triggers based on the number of cases on campus, the proportion of total students who are infected, or the number of cohort closures over a certain period of time that would represent collectively unacceptable levels of school-based transmission and a more disruptive experience for families, et cetera, based on frequent cohort closures. And we have not triggered that in any of our schools.
And that would be one where the state has defined a threshold right now of 5% of the school community who are on campus testing positive with COVID-19. And I think this is a place where you would see Marin County Public Health, especially since we're leading and opening, potentially have a more conservative approach around a school closure in order for us to, if that does happen, for us to make sure we're taking the most conservative protective approach in our response to increase COVID-19 cases in the school environment. So the state has given us guidance, but again, we are going to we follow our data on a school by school basis, and we'll always confer and make a decision that we think, even if it's more conservative than the state, to ensure that we may maintain trust with the school community, and that we are acting and making our decisions not only guided by science and data, but with the focus on protecting students and staff.
Do you anticipate testing to be required? And then the next part of that question, do you anticipate vaccinations to be required?
You require testing for we strongly recommend, it's not mandatory, we strongly recommend all school staff get tested every month. And we strongly recommend anyone that knows that they engage in a high risk activity and in a gathering to self-isolate and get tested or quarantine themselves and get tested 5 days after that high risk activity. We have not mandated or ordered testing at this time. We really believe in voluntary compliance is the best way to achieve a successful public health response, and orders are not the way. We are not anticipating any orders around the COVID-19 vaccine. Our responsibility in public health right now is developing an effective communication plan that really helps our community understand the benefits of COVID-19 vaccine and the safety and efficacy of that. And at this time, we don't see, there's no growing thoughts around an order for requiring vaccination. There might be other sectors like travel that many families might opt to want that vaccine because there's other activities that are mandating vaccinations. But anything else you want to comment on, Matt?
I would just say there's one area where testing would be required, and that is if there's a known close contact, and you alluded to this just to make it explicit. If there's a known close contact, that person is required to quarantine before they're able to return to work. And that is an order. And that you can get shorten that interval of required being out of that environment by significantly with the new regulations around quarantine. So a test at 5 days after the last exposure, if it's a negative result, allows you to come out of quarantine, but only with that test. So in that context, a test would be required.
A question came up about what mental health support is being provided in the county. So Michelle, if you could put into the chat the list of all the activities that we're involved in currently. I think we're looking for the one that has a date that was November 23rd. If you could put that into the chat to make that available. There's multiple questions about travel and what is the expectation related to travel? Is there any travel that you consider safe? No. I mean, it's the simplest one word answer to that question would be no, not now. Stepping back, almost every state is seeing record numbers of COVID-19 cases, and we're in the state of California, 30,000 cases on one day over the weekend. Marin, we had a record number yesterday, I think 89 cases. So the risk is just amplified significantly anywhere. And so, we've been concerned about travel even a few weeks ago, pre-Thanksgiving signaled that we wanted people to quarantine if they did choose to travel. But now it's really a much stronger message that traveling is not safe. Our hope is that with some of these interventions, we're able to kind of do the circuit breaker. That's how I'm thinking of this. Shelter at home is a circuit breaker to kind of reduce the incidence, and that would free us up for more freedoms to travel sooner, but now's not the time. Ken, can we go back to you then?
Yes. How is contact tracing handled for those who are infectious while in school? Is it limited to on-site interactions on school campuses, or is there full contact tracing to those they may see in non-school activities?
So we have two arms of our contact case investigation contact tracing team. One works with the schools. So once we identify that an infected person has a possible school exposure, be it that they're a school staff or a student, then our schools team engages with the school team, at the school and the district to manage our response with cohort closures, notifications, recommendations for testing. At the same time, we have our case investigation team and contact tracers who will also be calling that individual who tests positive to identify their other close contacts. And this is again where we really depend on individuals self-reporting who their close contacts are, and it depends on the person how willing they are to report their close contacts. So we have two arms of investigation and tracing that happens. We're also going to have a new tool from the state, which is a Google Apple platform that will we anticipate will support our efforts to more effectively identify those close contacts who may have been exposed, who may have had an exposure, and then notifying them. So there's more technology coming from the state. But if someone tests positive in the school environment, there'll be a schools team as well as our case investigation team working, we call it working the case.
So there's a question that we are going to need to clarify. The question is, how accurate is the data on the Marin H&HS? Looking at statistics for some schools in Southern Marin, I'm showing that the data has not been updated since October. And I know we've had confirmed COVID cases at one of these specific schools. How can we put our faith in that data? That's 2 months old.
There have been cases identified at schools, but if that case was not on campus during their infectious period, so there's cases that are related to schools, but they weren't on campus during their infectious period. They may have been on vacation. And so those cases would not be counted in our school-based transmission, even though they might be a student, they just weren't at school during their infectious period. If there's any, I would email COVID-19 schools or call our team at 7191 if you have a concern about the data, because our commitment is transparency in data. So we believe that we're reporting all of the known cases of school-based transmission and of the students that we've investigated. And again, of the students that 37 that's on that slide, and we're only investigating individuals that may have had exposure on the school campus. So students that are in full-time remote learning would not be listed on that data. So if you see a data error, please email COVID-19 schools so we can do quality assurance on our side and make sure it's accurately reflecting the experience in the school community.
And the dashboard that's available through the county EOC is in fact updated every week on Friday. So it is updated. And if we could have someone put that link into the chat for people, that gives you information about the number of students, what's happening at schools, what schools are open or closed, along with the specific data that Lisa just mentioned in terms of any transmissions that might have happened in school. And just to note, there are 2 transmissions listed currently, and those both were adult staff to staff. So there have not been any student to student, student to staff, staff to student, etc. At this point. Ken?
Can you address playground closures? It seems to some, actually quite a few in this chat, sort of counterintuitive, where it could be an option for keeping kids distance and active outside. Is this a state mandate? Does the county have any authority?
It's a state mandate. It goes on with the state stay-at-home order. And it's based on the philosophy and the goal of the stay-at-home order is to prevent gatherings of any kind. So the social bubble concept has been suspended. We were some of the early champions for advocating for reasonable gatherings of people in more than one household, and we're the first county around the social bubble concept. We recognize the value of being able to gather. Unfortunately, because of these dramatic surges in cases and people rolling into ICU, that has been, they're no longer social gatherings. So the reason that I think what's the rationale in the state's mind is that playgrounds represent a hub for gatherings of families, and what's happening around the playground in terms of the parents interacting is just as important as what's happening within the playground itself.
How do these new orders affect social bubbles that may have been created over the past months, and can we still do that?
No, I think, if it wasn't clear in the previous response, that's no longer allowed, unfortunately. And this is temporary. This is one of the more painful ones for us, I think, at least and myself as public health officers. But this is a time where we're not, those sorts of social gatherings are no longer allowed.
Mm-hmm.
Yeah, and I think what we've seen is the social bubbles, some stop being as strong of a bubble. People over the past couple of months expanded their bubbles. They weren't just consistently staying with the 3 households anymore. They started having multiple different bubbles. And again, those are all the behaviors now that have led to slippage in our personal protective behaviors. Dr. Hernandez from Berkeley said the social bubbles popped for now. We want to return to that place where we can again safely begin gathering with other households. But at this point, no play dates, no mixing households. That's what's going to stop us from, that's what's going to flatten the curve right now. And we really believe we have these next 3 weeks where Marin County proved itself before. We learned from our July activities and summer activities that we needed to follow public health guidance. We have these 3 weeks going into the winter where we can work together again to flatten the curve. And there is significant sacrifice again from our small business communities, from our children again not having play dates and having more isolation than they had before, which I think goes back to again that critical importance of school being open, so children can see other students and engage socially and safely and supervised during these next 3 weeks. It's a critical time for schools to be open. And as we do need to hunker down and stay at home, that's the simplest message.
There were, Michelle Drake, if you could help me here, there were a couple of questions that came in Spanish, and I know we translated them, but I can't find them. Would you mind reading those?
Hi, Mary Jane. Those questions were translated. I'm just going to come back up.
Sorry.
It was around the water sports and if water sports can still be played.
Outdoor pools are allowed at this time and following the guidance. And again, it should just be strength and conditioning, not competitive play.
Okay, there have been a couple comments about the time of this session, and just want you to know that we end up trying to pick a time that works for public health. These are being videoed or recorded, will be available within 24 hours for anyone who was unable to attend. And in addition, this week on Thursday evening, Dr. Santora and myself actually will be involved in a town hall put on by the YMCA that will be held in the evening. So we can go ahead and put that in the chat as well. Dr. Santora or Dr. Willis, any final comments before we need to end this session?
I can also, tomorrow there's going to be a town hall for the community as a whole to talk about the shelter at home order and some of the questions that weren't, I was observing that lots of questions coming in on the chat, just don't have time to get to all of them. Many of them are answered if you go to our website at the frequently asked questions, but also there's another opportunity to engage tomorrow at 2 o'clock, I believe. Is that right, Lisa? For the town hall forum under the Marin Recovers group.
Okay.
And I would just, I guess by way of closing on my end, this is a hard way to end what's been a hard year. I see 2 lights here. One is the success that the school community has had in reopening safely. Again, I think that the numbers, I am an epidemiologist, and so no matter, there was a lot of politicization of this, a lot of strongly held ideas on both sides. The answer is just by observing and measuring and being as careful as you can to actually measure what happens and then make your decisions. And I think if we take that more scientific approach, we can say securely that our schools have reopened safely in Marin County when we take a more objective view. We are seeing a lot more transmission outside of school settings than we are inside school settings. And so closing schools, from that very simple perspective, closing schools doesn't necessarily protect us at all, because the transmission is occurring outside of school settings. And if we see social value in having children in schools, those are important. Those are 2 important things to take into account. A, tremendous social value, and B, there's no real evidence that it's any riskier than it is anywhere else. And in fact, it may even be in some ways protective based on our data. So I think that's important for us to sort of carry forward. The skills that we've acquired and refined over the past few months are those same skills we're going to be needing to lean into over the next few months. You know, the vaccine's not going to be out to the general population until probably April. And so, you know, at that point, I think we can look forward to a whole new world, and we can all breathe a lot easier. But until then, it's a matter of sticking together and getting this right. And I just want to express my gratitude to all of you for the work you've done.
Great. And thank you, Dr. Willis and Dr. Santora, for all that you've done to guide us. We appreciate it very much. And we wish for everyone on this call happy holidays and look forward to our next opportunity to be together. So thank you very much.